Before my treatment with Dr. James, I had like chronic lower back pain that would come and go in like monthly waves. It started, okay, 6 weeks, I have this really bad back pain, and then 6 months, no pain, and then 6 weeks, really bad pain, and then 6 months, no pain. So I did that for about 4 years. And then right at the beginning of 2019, I started having really bad sciatica. And sciatic pain was like the worst thing I've ever felt in my life. I don't wish it on my worst enemy. But I couldn't sit for long. I couldn't stand for long. I couldn't look down at my toes. I couldn't bear weight on my left side. It was really bad. And because I am a dance teacher, I couldn't work. I was grumpy all the time. I couldn't pick up my kid. It was just really bad. And I couldn't take it anymore. So I did some research on a doctor that could take care of my body and do a good job, and who had done good jobs previously. My appointment with Dr. James was shocking. I thought he was going to say, oh, we're just going to, recommend this physical therapy and, you'll be all good. When he said surgery, my heart dropped. I got super, super scared and like immediately started crying. But, that was okay. And he went through and he told me about the ALIF surgery that I ended up having. That freaked me out completely, because I knew that I was going to have to go through surgery, and I don't like surgery at all. I don't want surgery. So I took about maybe a month and just kind of rested on his recommendation. I did a lot more research about it. And then, of course, I got a second and a third opinion because I did not want to have surgery at all. And I got 2 different recommendations from those other 2 doctors. But then I still came back to Dr. James because his recommendation was the best recommendation for me. And I appreciated his honesty. I appreciated his foresight and his consideration that he gave to my career and my age and my propensity to heal. And I thought that made him a very trustworthy doctor. So that's why I ended up going with Dr. James as my surgeon. The day of surgery, I was excited and very, very nervous. My mother was very, very nervous. My husband, very, very nervous. I don't even remember where my son was. I was so nervous. But we go to the hospital, we check in. It was a very quick check-in process. I get prepped for surgery. I remember saying, count to 10 or something, and I was gone. I woke up in my room, and I didn't have any pain when I woke up in my legs. Like, like I had had major surgery, so it wasn't like, great. But it was nice to not feel that pain in my left side anymore. I remember that very starkly, and that was like relieving. So when I felt myself come to consciousness, I was relieved in that way. I was walking. Dr. James had me up and walking, I want to say like 3 or 4 hours after the surgery. As soon as I was like up and fed, he was like, okay, now it's time to get up, time to start walking around, which I appreciate, because that's the healing process, however difficult it may be. And yeah, I was out of there. The worst thing about it was I had the flu while I was getting over the flu, so I was really extra hands off from the nurses and everything, but it was cool. I am still in recovery, and I'm still in the follow-up process. I am almost 1 year to my surgery, so I'm actually really excited about that milestone. it'll be a year on May 13th. And today's like May the 7th. So I'm really excited. I'm supposed to have my 1-year follow-up next week. I don't know how that's going to go with this, COVID life, but I'm really excited. My recovery up until now has been very purposeful. I am a very disciplined student. When I was told not to bend at the waist, I didn't bend at the waist. When I was told not to lift heavy things, I didn't lift heavy things. I was very well supported by my family during my recovery time, and I'm very thankful for that. And every time I came back to Dr. James, to the office, because I didn't always see him, and that was fine. But they were very informative about my progress. They took my x-ray every time, and they were able to show me what's healing, what's this is happening. And it was interesting to watch that, and then to just, the therapist they gave me, Adam, shout out to Adam, he's awesome. And we got to the root of my problem that originally caused the sciatica. So, it's just been a really, really pleasurable experience, considering the fact that I had back surgery. And I'm still in recovery, so I'm interested to see how much stronger I can get. I am not as flexible as I used to be, so that is a goal right now. I've started doing a lot more yoga than I did before. And yeah, right now I have no complaints. I don't have any sciatic pain. I can touch my toes, I can dance, and everything is peachy keen.